So my name is Tiffany Wilkie. I am Dr. Lewin's microtia patient liaison. I know many of your friendly faces, but my son has bilateral microtia atresia and has also had the ear reconstruction process. Today's webinar is called Caring for Your Post-Op Ear, and we have Dr. Sheryl Lewin, which I hope you guys know, and also our fabulous nurse, Maribel. And
Hi.
so they are going to help guide you on these different post-op instructions during surgery, after surgery, when you go home, and then, you know, your lifetime care. Dr. Lewin, you want to take it away?
Sure, absolutely. Hi, everybody. Thank you so much for joining our little post-op care Zoom here. I just really wanted to make a few points, sort of starting with in the OR. These, as you guys probably know, are fairly technically complex. And so they obviously take a long time to make. And then that healing process, I think everybody has a hard time understanding like just how long it takes these ears to heal. So you'll see it at 1 week after surgery. And then for the first couple months, there's sort of a lot to do that Maribel's going to go over. But really, it's 6 months to a year before they're kind of healed to the point that they're pretty stable. However, even at 1 year, 2 years, even sometimes beyond 2 years, certain things continue to change and improve a little bit, like the incision lines and the color of the skin grafts and kind of how the skin grafts feel. They tend to feel more like normal skin over time. The other thing that is a challenge, or somewhat a challenge for me, is you can never predict how any one patient is going to heal. And that means that, you know, when you see pictures of children's ears, like on social media, you have to understand everybody's healing not only with a different appearing ear, but also at a different rate. And to be honest, we don't really see a correlation with, you know, how swollen or red or purple or raw they appear at the beginning. Maribel can attest to this too. It can go on to, you know, have absolutely beautiful ear, and you just never would have known it was that sort of impressive looking right after surgery. So we don't really count on that. The other last kind of big point to make is, given how kind of complicated these are, the ears require a lot of maintenance in the beginning, but really for your lifetime, there's still going to be some maintenance. And that's mostly just spending a few seconds looking at the ear, front, back, and just making sure there's no unforeseen injury primarily. But we'll go on to go into more detail as Maribel goes through our points. So you'll be well educated on that.
Great. Okay. Well, Maribel, if you want to take it away for, we go to pre-op, we go to surgery, and then after surgery, how do we take care of that post-op ear?
Okay, so after surgery, the child will have the ear wrapped in bandages, and then it's going to be maybe about 2 to 3 layers of bandages, and then they're going to have the ear cup. Just letting you know, parents, that dressings will be sutured onto that, about 2 sutures here and here. So it's very recommended that your child tries not to take it off because it will be painful. We've had kids that have ripped them off, and that's not a pretty sight underneath. And on your first post-op, we wash the hair. Dr. Lewin reveals the ear. You guys are able to see the ear. Just keep in mind, like Dr. Lewin mentioned, it's going to be purple, reddish, kind of not pretty looking. So just don't worry if the ear doesn't look good. We'll let you guys record the reactions. So sometimes the reactions are not what you guys expected from kids, or sometimes the teenagers or adults even. After that, Dr. Lewin usually goes on letting you guys know how the ear looks, how she feels the next treatment will be for the following appointment. Depending on your kid's age and how the ear looks, we'll either wrap up the ear again so you won't have to do anything for another whole week, or sometimes your dressing changes will be daily, and then we'll let you guys know how it is. If you guys do have dressing changes daily, we'll show you how to wash the ear. If it's bandaged up, Dr. Lewin usually You guys won't have to do anything. And I'll let you know how to remove the dressing changes the night prior to coming back into the office. Anything you might want to add, Dr. Lewin, before I move on to the second post-op?
Actually, I might just chime in if you don't mind, Maribel. Can you explain to the viewers how long you're in California for these post-op appointments?
Okay, so usually US patients are in California for 2 weeks, internationals for 3 weeks. We strongly recommend that you guys get plane tickets that can be interchangeable just in case the ear's not healing, as how Dr. Lewin would predict, just in case you guys have to stay for an extra week. We usually don't have kids or families staying for an extra week, but it's advisable just in case.
Okay, and just going on right after that first post-op, can you explain, you talked about the ear cup, can you talk about maybe what is on the skin graft sites?
On the skin graft sites, so Dr. Lewin usually grabs skin either from the opposite ear, the arm, or the abdomen. So if it's the opposite ear, you don't have to worry about that because it's going to be wrapped up. If it's the arm, it's also going to be wrapped up with bandages. So for the first week after surgery, we recommend no showers. You'll just basically be doing sponge bathing. If it's a skin graft from the abdomen, they'll have a surgical tape. Once we check those on the weekly basis, when you guys come in, you don't have to do anything to the skin graft sites. We just monitor the skin grafts and let the tape fall off. For the kids that do have abdomen skin grafts, we recommend to take it slow. Try to not have your kids jumping around because there's fluid that does collect in the abdomen if they're bouncing around or very active. And that if the abdomen fills up, we would have to remove that liquid prior to you guys going back home.
Okay. So, and again, going from surgery date to that first post-op, what do you suggest for what families should do within that time frame, or what they should not do during that first week right after surgery?
So the first week we usually recommend, some parents don't like so much electronics or devices, but this is the week where we recommend you strongly give it to them, or it's quiet time, quiet play, no running around. If you guys are planning on going to Disneyland, we usually recommend you do that prior to surgery, and maybe the week after post-op with Dr. Lewin's recommendation only. If she approves, it's okay. We usually don't recommend you guys to go to Disneyland the first week after because excessive walking for several hours will cause in the abdomen to swell up. We usually recommend for you guys we recommend walking, just not too strenuous for the child.
Right. And for those who might have tuned into our other Zoom webinar, we had a PIER travel tips, and we did talk about many tips on things to do after surgery. So we will send out that recorded link, and I hope you tune into that for some further information. Another thing during that first week post-op, can you address what medications might be provided to the child?
So on the day of pre-op, we give you guys about 4 medications. 2 of them would be antibiotics and pain medication. Those are the ones you'll take definitely right after surgery until you guys see us. For the other 2 prescriptions, they're usually ointments, and you'll bring those with you on every post-op visit, and we'll instruct you on how to use those.
And one last comment about the first week. What about the California heat?
It is extremely hot. So since your child will be having bandages and an ear cup, we recommend no excessive exposure to the sun. Your child can get itchy, very uncomfortable. Sometimes they might develop a rash or blisters or even fungal infections. So we just recommend you guys keep indoors for the first week at least, just because the child does have all the bandages.
I can elaborate on that a little bit. What happened in the summertime is we would see rashes occurring when we would take the bandages off the first time. And we finally figured out that it was correlated to how much the kid was sweating and how hot they were getting. So we were very strict. This was a couple summers ago. We were very strict after that time point to not let kids get too sweaty or anywhere near water, steam, theme park misters or anything like that in that first week while all these bandages are on the ear. And that essentially completely solved our rash problem. So as long as we stay pretty dry and, like Maribel said, not too active in that first week, then we're in good shape.
Great. Maribel, you want to transition to the second post-op visit?
Yes. So for even on the first post-op visit and on the second, we strongly recommend you give them pain medication just to ensure that your child will be comfortable. For the second post-op visit, I do excessive cleaning of the ear. The ear usually peels, the skin peels, kind of like how a snake sheds its skin. And it's not painful. Most of the time kids don't feel it. If they do feel something, they are gonna feel maybe like tingling sensation or poking because the ear is still pretty numb. Even the scalp area is also gonna be numb, and with time, they'll slowly get more sensation to the ear. You guys will not be required to do the extensive ear cleaning that I do at the clinic. It's just kind of to help you guys out to get the ear as clean as possible.
And did you, before that second post-op visit, for the first post-op visit, you don't have them touch the ear or do anything, they get their hair washed. But what about for that second post-op visit? What are parents supposed to do before that appointment?
For the second post-op visit, if your child goes home with the ear dressed up again, you don't have to worry about it. The night before, we recommend you to place your child, give them a good shower or bath, get the ear completely wet along with the dressing and the bandages, and then you'll remove the dressings. You won't have to worry about cleaning it. We just recommend you pat it dry, put the ear cup back on, and then you'll see us on the second post-op visit. We'll show you on the second post-op visit as well how to clean the ear. So you'll grab us, we'll show you how to do this in the clinic. You'll grab a gauze, soak it with water, add soap to it, make it very soapy, squeeze out any excessive dripping water just so you won't get it all over your child. And then you'll scrub in the circular motions the ear. It does not hurt. Your child, always with parents, say it hurts versus when you see them with me in the clinic. And you're gonna notice that difference with some parents that have had it. But it doesn't hurt. It's just might feel weird for them. And you don't have to be extra delicate. You will not injure the ear with the cleaning. The water does not injure the ear. So just make sure you give a good cleaning to the ear. And we'll show you how to do all that.
I would say that's the single hardest thing for us to teach is, you know, we tell you they're delicate, be careful and all these things, but really, you know, you can scrub them. And we really want you getting all that, you know, sort of those dead skin cells from the skin graft, like she was saying, like a snake kind of sheds, these skin grafts kind of shed. And the thing that's nice is once we clean it, then the medications we're putting on, the ointments and such, will get to that skin and it'll be nice, fresh and healthy. So it's really about getting parents to feel comfortable that you don't have to be super delicate, because that unfortunately won't get the ear terribly clean.
And then Maribel, during that second or last post-op, do you then provide families with how to, you know, go forward and do their cleaning, or what happens there?
Yes, so we'll recommend you guys to either take notes. We strongly recommend that you record it with your cell phone so you can see how I clean. That way, once you guys get back home, since we give you guys so much information, you can always refer back to your video recording on how to take care of the ear. If after reviewing your notes and reviewing the recording, you still have questions, feel free to email me at photos@lewinmd.com. And then I'll tell you step by step how to clean the ear. We also sell a post-op kit that has gauze, it has Q-tips, it has a little bottle of soap, hydrogen peroxide. It has the basic essentials you guys might need to clean the ear, just to get you guys started so you won't have to be running all over the place trying to find the supplies you might need to clean the ear. We also strongly recommend to bring some medical grade scissors, just the little ones, something you can put on your carry-on bag, just in case for the dressings, if the gauze is too big for your child's ear, you can custom cut the gauzes to fit its needs.
Mm-hmm. You know, Maribel, those videos are so key. Like parents, you think that you're listening and you're paying attention, but you have a kid, you might have another sibling there. There's a lot going on. Let's face it, your brain is probably fried. take notes and take that video. Like, just take it from me. You just have a lot going on and you think you remember stuff and you don't. So, or you might want to have, you know, your spouse watch it, or grandma, or somebody else who might be, you know, helping with those cleanings, to let them watch it as well. It's a really good tip that Maribel just said. And how long are you gonna clean it? Like after you leave Los Angeles, about how long do you clean the ear?
So once you guys go back home, you will be taking care of the ear for about 3 months, which you will be doing cleaning twice a day, every day. You'll be submitting photos to us on a weekly basis. So it all depends on how comfortable you get. Since you'll be doing the cleaning twice a day, it can take you anywhere from 5 minutes to up to 45 minutes. And like I mentioned, it all depends on how comfortable you get with cleaning the ear.
Okay, we have some great questions. Might as well just go right into them. Why not? It says, first of all, how long do you wear the ear cup for after the second post-op?
A little bit dependent on if you have a canal, if you don't have a canal. When there's a canal, I like to use the cup longer at nighttime, only at night, because the worry is that you want that implant kind of stuck down right where you placed it, and you don't want it dropping down over the canal, which can be a problem in the past, but now I think we've pretty much fixed that issue. And then in terms of if you don't have a canal, usually you just wear it at full time for 3 weeks, and then at night only between the 3rd and 4th week, unless you have a very rambunctious kid and you feel better with it. We're fine if you stop wearing it at that point, but I feel like, Maribel, a lot of parents keep it on a lot longer. And I think, you know, from my standpoint, I'm a worrier too. And so if you're a little more like careful with the ear, to me, that's all bonus. I love parents that are obsessive compulsive because their ears are super clean, and parents that are more cautious than risk takers, because just makes us think that while this ear's healing, those first 2 months I think are real important. And then the 3rd month, you know, we probably go into a little lower mode of care, and things are quicker, and we're at just, you know, rubbing an ointment on there once or twice a day.
I have another question here from Valerie. We're still having some skin buildup, and have been using a baby toothbrush to scrub the ear, but can we get into but we can't get it quite into the bowl in that area. What would be a good alternative to clean the buildup in that bowl area?
So that's, for some reason, that's common in the first year, I would say, at least first year. Some, you know, the skin can be different with each kid, and some people never have to really clean their ears after that time, and some people do have like this buildup of dead skin. For in the bowl, I like dipping a Q-tip in acetone, straight 100% acetone, which is nail polish remover with no colors or smells. And you can kind of turn the kid over and drip and let it sit in the bowl for a little bit. And then with your Q-tip, try to peel the dead skin off. That's one option. We've had a couple parents, Tiff, maybe you recall, that have used different oils that they kind of put into the ear. Not baby oil or olive oil, but like
coconut oils and stuff like that I've seen.
So I think it depends on, you know, your kid in particular. There's not, I think it's just that skin, as I said, can sometimes be a couple years before it's really like done changing.
You know, and I think a lot of these type of like parent, obviously, you know, the office gives, you know, the advice and always follow that. Some of these little tricks, as you get even further out from surgery, it's great to go into our private Facebook group. And I think a lot of you guys are already there. It's into the, you know, the facebook.com, then you go to groups and it's called Lewin Ear. But that's where like post-op patients or post-op parents and the pre-op parents can kind of talk with each other. But a lot of people have tips and tricks like, what kind of sunscreen do you use? What kind of oils do you use? What do you do to wear glasses and things like that? So, you know, as much as we can help give advice, obviously parents, you know, always have their little tips as well. So I would suggest heading that way. All right, Maribel, we will keep moving along. Do you, Maribel, do you want to address post-op after you go home and start with submitting photos?
Yes, so we'll ask you to submit photos to the email provided. We'll give you we'll give you the email along with other tips and handouts for you guys to keep referring back to how to take care of the ear. But when you submit photos, we always recommend please wash the ear, pat it dry, make sure there's no dripping water, because if you guys submit photos with that, Dr. Lewin's gonna be worried that there's something going on with the ear and it's only water dripping on the ear. So just make sure your pictures that you send are clear and focused, preferably in natural sunlight or with good lighting. Please make sure that there's no shadows. If you are concerned with a certain area, we recommend that you send a close-up picture of that area. And when you're submitting pictures and your subject line, if you're worried or concerned, please make sure you write that in the subject line. That way we can address to your pictures or your concerns as soon as possible. For regular weekly photos or bi-weekly, however we tell you guys to send them, we just recommend you guys send them on a weekend or on a Monday. Then Dr. Lewin would see them most of the times on Wednesdays, and then I will reply either Thursday or Friday mornings on how your what next treatment will be. We guide you guys along the way. We don't let you out like saying, okay, bye, nice seeing you. We keep close contact with you guys.
And obviously the other thing, you know, or many of you know, you will be given my personal cell phone at your pre-op appointment. And I tell everybody, you know, if you have any concerns about the ear, you can call 24/7, 365. Honestly, my phone is never changing. But if something happens at night or on a weekend, I want you to call me. So you just use that. It's quicker than going through the service, and we'll be able to address some, you know, urgent laceration or bug bite or whatever it is at that time.
Great. Maribel, what about returning to physical activities? That's always the big one. When can I play sports? When can I go swimming?
Typically, it's 6 weeks after surgery, unless told otherwise by Dr. Lewin. So after the 6 weeks of surgery, that's when they will be able to resume swimming, any active sports. We have most of our kids, all of our kids are in sports, and they're able to resume back to any physical activity. The only sport that we do not recommend, or it shouldn't be considered for your child to have an ear, if it's boxing, because then they'll get the cauliflower ear, and then it's like nonstop complications. So there's no use of getting a Lewin ear if it's not going to be perfect.
Or any ear.
For any
rib
ear.
cartilage, porous implants, anything.
Yes, anyone in general.
We're just assuming it's not a good idea. We haven't actually had a boxer yet, but I do remember a 6-year-old who was into boxing who gave it up and took a football or something instead. I don't know how much better, but at least you have a helmet.
Yeah. So going back to swimming though, you know, if you do, like me, I actually work remotely in Wisconsin, and we kind of address this in our other webinar, but you know, we only have a few good months, and swimming is super key for like our family. If that is really important to you, you need to realize that your child will not be swimming for 6 weeks, maybe 7, maybe 8, who knows? So while everybody loves that June surgery date, just realize you're kind of giving up your summer for that. So, you know, January surgeries aren't always that bad of a deal unless you live in, you know, always beautiful California. All right, let's move on to lifetime care. Maribel?
So with lifetime care, you're always going to be taking care of this ear. We also recommend, if your child is a teenager or is getting close to the teenage years, your child is not going to want you close to them. So we just recommend that you start teaching them how to look out for their ear. Just once in a while, give a good glimpse. Even parents, just take a glimpse at the ear, make sure that there's no issues or concerns. We do recommend, if you're going to be out in the sun, you put sunblock, SPF 30 or higher. The more wise and more, what we found out with parents, the easier it is. It's the spray sunscreen. Just make sure you wash the ear after every use, because the sunscreen does create buildup afterwards, and then you'll have the issue of how to clean the ear with buildup.
Mm-hmm.
We're also that your kid can go back to sports. We do recommend if your child wears glasses, usually we recommend those to be used at 2 months. If your child has to use glasses, we just recommend you pad the framing of the sunglasses or the glasses, I'm sorry, and make sure if the curvature, so I'm gonna show you my ear. Our worry is when the glasses lie here. The constant rubbing or friction can create a problem. So we just make sure the frame of the glasses for you to use either gauze or foam or a soft cloth just to pad that area.
And if I can interrupt.
That's a temporary issue, but you'll sort of understand when it's okay to not use that anymore when they're wearing them and it doesn't leave a red mark on the ear or on the scalp. So that gives you a sense of that. One other thing to mention, which is particularly prevalent today, is headphones. I don't think we talked about headphones yet, but short-term use is not much of an issue, but the problem is that people don't really use headphones so short-term anymore. So hours of pressure on your ears is not good for a porous implant ear. And so we had one patient who was, sort of wearing tight headphones for many, hours a day for many days, and he developed a sore. And so sometimes the sores just heal on their own, but if the sore is significant, then you may get an exposure from basically a pressure problem. So just make sure they're either very loose or soft, the ones that like earbuds that are softer, or the ones that are, I think they're called bone conduction headphones, and they lie above the ones that athletes like bikers use, which allows you to hear traffic, let's say, but you can still listen to music. What's the name of the one? Aftershocks?
Aftershocks.
Yeah, that's maybe one of the more popular ones, and there's a whole bunch of other maybe more cost-effective versions as well.
So like these type of earbuds are not a great idea.
I mean, it's not that you couldn't use them, because nowadays where the canal's meant to look very much like your canal with the 3D, you might be able to get them to fit in there. It's just they're hard, so I always worry that you just don't want something hard rubbing against that skin.
Right. And really the bone conduction headphones probably does a better job, but
probably does. True.
Just a couple things on the sports equipment, just from a mom. He's now 13. He does play competitive baseball. And so like, for example, he wears, but do you see how like they go straight?
Yeah.
The helmet, it stays above the BAHA, stays above the ear. So you just have to kind of, that is unstable. Sorry. The other thing is bugs. Maribel, did we talk about bug spray yet?
No. So if you live in a region,
okay,
or pretty much anywhere where there's mosquitoes, we recommend you use bug repellent spray. If you do get a mosquito bite or a bug bite, the ears are gonna get crazy swollen. Don't freak out. We usually recommend that you send us a picture. If you're very paranoid, take a picture every day, and if you want to submit it to us, go ahead and feel free to submit it. It usually takes anywhere from a week to 2 weeks for the swelling to go down, so don't freak out. The ears will also get swollen if you get hit, bumped, or banged. Most parents that have had the ear reconstruction already will tell you that this is a time where their ears get hit, banged, or bumped the most, even though before they never got hit. It's weird, right, but it happens. So just don't worry about it. If your kid ever gets a skin tear or a laceration, send us a picture right away. Please clean the ear before you send the picture, because if you send a picture when it's all bloody and dirty, we won't be able to help you out on what's going on. Submit a picture, and we usually tell you on how to take care of the ear moving forward from there.
That is probably worth addressing a little more specifically, because obviously a parent is going to, freak out understandably if your ear gets hit by anything that causes a laceration. But these ears actually, sorry, something loud passing by. Sorry. These ears get bleed just like a normal ear when they get injured, which is a good thing because it allows your ear to heal. So we do, if it's bleeding, you just put pressure, much like you would on any other part of the body that's bleeding, and you just hold it there. Don't check or look 3 to 4 minutes. That usually does enough to stop the bleeding. Then you can go back and do some cleaning and take a picture while it's clean, and then go back to the pressure. There was a kid, I just will never forget this one little girl. They were from Chicago, and her dad was the super nervous one during surgery. Mom was fine. And they left, everything looked perfect with the ear, and they went to dinner to celebrate your new ear, and we're done wearing the cup 3 weeks after surgery. And then she fell at the restaurant, hit the side of a table, and got like a significant laceration, 2 centimeter laceration, cut straight line. So the dad calls me, he's freaking out. He's like, I'm having an ulcer. I'm getting on a plane. I'm going to the airport now. I'm like, just wait, just hold on. And we can talk you through exactly what you need to do. You literally butterfly the laceration, much like you would a cut on your kid's face or you know, extremity. So just, you have my cell phone, call me if you need me, and we'll talk you off the ledge. And these ears just do amazing well. That kid never needed to come back to LA.
Dr. Lewin, if there is a bump or a mosquito bite or something, what's your take on ice?
Oh, good question.
Actually, Kim reminded us. Thanks, Kim.
never use ice or heat on your ear. This flap is just, it's not like every other part of your body. It doesn't like cold and it doesn't like hot. It doesn't like extreme temperatures in the environment, meaning, you know, if you're going skiing, it needs to be warm. If you're going somewhere really hot, it needs to stay cool. But in particular, ice can injure the ear, and so can heat.
We have a few, I'm sorry.
Oh no, I just saw that question pop up.
Oh, sure. A couple questions quick. You know, right now with the times with like the masks, you know, that people are wearing out and about, is it okay to use the ear loops with Lewin ears? The James family is 9 weeks out. The paperclip trick seems to be too tight for the top of the ear. You know, do you have any suggestions?
So I would say the best suggestion is to use the kind of mask that we use in the OR. So, and it's because even when you have ears that are not surgical ears, long periods of time wearing those masks can be, you know, sort of annoying to a regular ear. And so we really don't want that on a PIER ear. So the regular masks we wear just have a tie in the top and a tie in the bottom, and there's probably alternatives. I know that some of the clever, I think maybe moms even from the microtia groups have come up with like an adjustable band. Even some little kids have a little business where they're selling these bands where the loops can go on the band. But if it's causing your bands to clamp down on the ear, that's not the best solution. It's good if you don't have an ear, but if you have 2 ears, for short-term use, those loops are okay, but for long-term use, I would say get the ones that tie.
Another question from Gail, how to wear a BAHA afterwards. She is bilateral. I could, you know, maybe address that. And we kind of talked about this in the PIER tips and tricks. You know, when you're unilateral and you have surgery, you still have one hearing ear. When you're bilateral, you know, you don't, and you have the big headdress and the ear cup, and it's really hard. So, you know, you just usually just wear the one and you try and find it here. I found some difficulty, and I kind of showed my 8-year-old nasty elastic band, but I kept in my little surgery box from a long time ago. Just bought the elastic, would cut off one of the blocks, and then use my little Velcro strips and just make my own BAHA band for that time. But it's super, you know, soft, but I could make it huge and just, you know, make it super big. Again, just so I could find like a corner of the head to use. And then afterwards during surgery, I mean, to be honest, we would just kind of use one on a band for a while just so we could adjust it while the one ear was healing, just to keep that, you know, sometimes these bands, like the harder they are, they can start to, you know, dig in there. So you do have to be really careful. Dr. Lewin or Maribel, do you have any comments on that?
I agree with the bands, because if the child isn't old enough to be aware when it's slipping down onto the brand new ear, you need to do sort of similar like glasses. You need to just keep into this little area. We call it a sulcus, but it's the space between the back of your ear on the top and your head. You can just put a little gauze or cotton or anything convenient that you can stick in there to protect it. The other thing we've been doing a little more recently on some bilateral kids is altering the dressing on the, so when you come for your first ear, that ear's all wrapped up, but over here where you still have microtia, we're clamping down that dressing tightly, like we're kind of wrapping it so that you have a place where your BAHA normally went, that you can use your BAHA. And so you can wear that even under the cup or over the cup, depending.
Nice. Here's another question. How long does it take for the coloring on the ear from the skin graft to fully integrate? What about how long it takes for the skin rippling on the donor site to smooth out?
So I'd say I'll take the second part first. The donor site looks most rippled or whatnot early in surgery and smooths out to be very smooth, probably, I don't know, 1 to 2 years out. Sometimes much sooner than that, but I would say by 1 to 2 years out. The first question on the coloring of the donor skin grafts, they retain to a certain extent the color of where they came from. So abdominal skin is a slightly different color than ear skin, which is a slightly different color than your cheek. And so they retain that essential coloring, and they kind of fade and blend. That's a minimum of 1 year, but I think the skin grafts continue to change out to 2 years as well. It's quite a slow process of changing.
And
Dr.
can
Lewin,
I add to that?
sorry, do you have birds going nuts in your background?
Me? Yeah. I'm sorry, I'm outside because it's so noisy. We have 7 people in our house. Sorry.
Tiffany, may I add to the color of the skin grafts? Dr. Lewin mentioned of how the skin grafts are going to look in long term, but while the ear is healing, I wanted to add the skin grafts do change different colors, maybe on a daily basis, but different times. Yeah. The colors range from red to purple, yellowish, whitish, sometimes even like a pale gray. And just to let you guys know, that is normal and it's expected. So don't freak out. The only colors we are worried about if it starts turning purple where it wasn't purple, if you start seeing a sore or an abrasion or anything that looks like a little hole, because if that's the case, sometimes we need to worry about that. Focus on those areas because those can turn out into an exposure.
Great. Another question from Joy. How about acne care in the teenage years?
So we haven't had too many people that get acne on the ear proper, but there have been a couple, and there's either, topical treatments or maybe a little better might be a dermatologist who prescribes, a prescription medication to help get the acne under control. I'm very pro treatment. Like, in other words, we've had some kids where there was acne on the places we were going to harvest skin from. And so, if the back or operating near, we would like that cleared up first if possible.
Great. Well, I think that is the majority of our talk. And I think we've answered most of the questions. If we missed any, you can go ahead and email info@LewinMD, but I do appreciate the questions that were submitted ahead of time, as well as this group chat.
One thing
Dr. Lynn, do you want to go ahead?
Yeah, there was one thing that I don't think anybody asked, and I don't think was covered, but I always forget to tell you guys about it. So I'd rather get it out here since it's being recorded. The flap. So that flap above your ear is taken from, quite a large area here, and it's removed. So, right after surgery, you get a little bit of fluid build up in there. We usually don't have to use drains for that, and the body absorbs it. What's fascinating is that the flap that we remove has nerves in it. So the consequences, both good and bad, are the scalp will be completely numb after surgery because what was giving innervation to the scalp is now on the ear. But those same nerves then grow into the skin of the new skin that's placed on the ear, and your child literally starts getting sensation weeks, or in the older patients, months after surgery. But up here, it's probably, I think, an average of 6 months, everywhere from 3 months to 12 months before that sensation comes back. And it comes back pretty normal because there's a lower layer of fascia underneath the one we take. Ours is a superficial, then there's a deep. And those little nerves within that give the sensation here. But like for girls, when you brush long hair, they can have sensitivity, particularly we see it in girls more, maybe boys as well, but there's just some sensitivity to that area in that first, year or whatever. And maybe some of that, lasts longer or lasts forever, like a little more sensitivity to the scalp there.
Dr. Lewin,
sorry.
Yeah,
sorry, may I add, since you're talking about the scalp and the flap, early on, because your child will be wearing the ear cup, sometimes you have hair loss in that area, and that's normal. Some kids get it, some don't. We don't know who will be getting it or who won't. If this hair falls off, most of the time it grows back. Yeah. It just takes a couple of weeks, sometimes even months, for the hair to grow back in that area.
Yeah, great point. And then the other thing that we sometimes see and sometimes recommend, especially maybe in an older kid, let's say 10 and up, is dandruff shampoo after surgery, because since that skin has a different tissue underneath it now, they can get flaking and kind of just dead skin from the scalp, and that dandruff kind of is easier to deal with if you're using a shampoo that is from the get-go.
Another quick question, just talking about hair. Is there a special haircut that needs to be done to prepare for surgery?
No special haircuts. I'm very minimalist in terms of shaving hair. I'd say, it's typically 3/4 of an inch, 1/2 inch to 3/4 of an inch, just right at the hairline around the ear. And that's all we need to shave. So if it's a girl with long hair, we braid the hair. And if it's a boy with longer hair, we can keep the hair long enough, like some parents may want the hair long enough to kind of cover the ear as it's healing. Not a problem, we can do that.
Great. Well, I think that basically concludes today's Caring for Your Post-Op Ear. I hope you enjoyed it and found it informative. It will be recorded so that, oh, funny, cute. Thanks, Shannon. You guys can, just watch it and rewatch it. We will also be sending out a survey. Would love your quick, super positive feedback, of course. And we already have 3 more scheduled of these live chats over the next couple of weeks. So I hope you continue to tune in. And Dr. Lynn or Maribel, do you have any final thoughts?
Griffin's mom, I think, just sent a little chat, which is a really good point. I'm assuming it was Griffin's mom. Said to get a fresh haircut before surgery for boys, if you wear your hair short normally, because they may be sensitive to getting a short haircut after surgery, which is great advice. And actually, if you ask the nurse in the operating room who does what we call the scrub prep for, cleaning the whole head, every time we see a short-haired boy, we're like, yay, it's gonna be so easy, because the long-haired girls are a little bit more work.
Maribel, did you have anything else?
Nope. I think
awesome. Well, with post-op care, just follow those instructions, read them once, read them twice, read them a million times. It's very, very critical. And of course, if you have any concerns we are a very available office. And so that is some reassurance to parents as well. Because the quicker, we can react to things, the better the outcome. So anyways, just wanted to thank you all for tuning in, and we hope to see you at our next Zoom event.
Thank you, everybody.
See ya.
Bye.
Bye.
Stay safe.
Bye-bye.